We focus now on an economic breaking point hitting kitchens and commerce across Long Island. Middle-class families and small business owners are warning that skyrocketing health insurance premiums are quickly rivaling rent and mortgage payments as their single largest expense. A combination of surging medical costs and major federal policy changes has triggered an unprecedented financial squeeze, threatening to price young professionals right off the island.
For thousands of Long Islanders, opening the mail has become an exercise in financial dread. New York state regulators approved premium rate increases averaging roughly 7% for individual health plans and a steep 13% across the small group market. While the Department of Financial Services heavily trimmed back the jaw-dropping double-digit hikes initially requested by insurance giants, local advocacy groups note that these hikes represent yet another painful layer of compounding increases over consecutive years. Insurers point to several major factors driving the surge, including standard economic inflation, a spike in the utilization of high-cost specialty medications like GLP-1 weight loss drugs, and significant price increases demanded by local hospitals and healthcare systems under severe labor shortages. But the real devastation for household budgets stems from a massive affordability cliff. At the end of December 2025, the federal enhanced premium tax credits officially expired after Congress failed to extend them. These credits served as a vital lifeline for middle-class families who make too much for Medicaid but struggle to pay full price for coverage. The Health and Welfare Council of Long Island reports that the termination of these subsidies means some individual out-of-pocket costs on the Affordable Care Act marketplace have skyrocketed by up to 50%. Statewide data shows that 20% fewer New Yorkers are receiving financial assistance compared to last year, forcing those who remain eligible to pay an average of over $100 more per month just to keep their existing coverage. The economic ripple effects are hitting Long Island's main streets the hardest. Local chambers of commerce warn that small business owners, the backbone of the regional economy, simply cannot absorb these surging benefit costs while simultaneously battling inflation and supply chain strains. Faced with unsustainable premiums, business leaders say they are being forced into impossible choices: slash employee hours, pull back on hiring, or transition workers to cheaper, lower-quality health plans with high out-of-pocket deductibles. Experts worry this crisis will severely stifle entrepreneurship, keeping workers tethered to corporate jobs purely for survival-level medical benefits. Compounding the anxiety is a looming shift in state-sponsored coverage. Because of federal funding reductions, New York is slashing the income eligibility limits for its popular zero-premium essential plan. This change is expected to push close to 500,000 New Yorkers off the program, forcing them into a volatile commercial market they already say they cannot afford.
A truly unsustainable path for families trying to stay afloat in one of the country's most expensive suburban regions. Regional leaders are continuing to pressure federal representatives for a restoration of those critical tax subsidies. We will continue to monitor this situation.